Is looking at a possible link between the COVID-19 vaccine and a rare heart condition. ABC 10 News reporter Jared Aarons spoke in depth with local doctors about this issue, who say this is not a reason to panic. It is proof that the system is working.
With every shot in every arm, the CDC has kept a close watch on vaccine side effects. Fever, fatigue, headaches, and injection site pain are the most common. But a report this month says they're looking into another rare side effect among young people: myocarditis, an inflammation of muscles around the heart.
It typically presents with chest pain, shortness of breath, which could lead to an abnormal heart rhythm, and that in severe cases can cause heart failure.
Dr. Abisola Olulade with Sharp Reese Staley Family Medicine says the CDC's announcement doesn't mean there's a direct link between the vaccine and the condition, but it's something worth studying.
It is a good thing. It means that the monitoring system that they have is working, and they're going to work to see if there is a link.
The CDC says cases were rare and mild. They showed up primarily in men who are teenagers or young adults within 4 days after the second shot. The report also says the number of cases of myocarditis after the COVID vaccine, quote, have not differed from expected baseline rates, meaning it could be just a coincidence.
There are people, regardless of vaccines, that are going to get myocarditis. We see it, every day. And so that's how you establish a causal link. Is it happening in people that have been vaccinated more than in people just out and about in the general population?
A similar report out of Israel found 62 people got myocarditis out of more than 5 million people who got their second shot. Doctors there could not find a direct link between the two. The Myocarditis Foundation lists dozens of things that could cause it, including other infections, bacteria, or even severe reactions to things like alcohol or drugs. And the American Heart Association says even with this new information, you should still get the vaccine because the benefits outweigh the risks. Dr. Olulade agrees.
There are so many things that we do and we let our children do that are extremely risky compared to the risk of getting a vaccine, and we still let them do it, such as driving, riding a bike, eating a hot dog at a fair.
The CDC also says people should still get the vaccine, but look out for myocarditis symptoms and report them immediately to your doctor. Jared Aarons, ABC 10 News.
Now, we know there are still questions about the coronavirus vaccine because it is still new. Our in-depth team is dedicated to getting major concerns addressed. And if you have a question that requires an in-depth look, send us an email, tips@10news.com.